Welcome to the HU Movemakers podcast, where we highlight folks that are blazing the trail and making moves in Howard culture. All right, welcome to the HU Movemaker podcast, where we highlight folks that have contributed to the legacy of our illustrious Howard University at the highest levels. So today we have a very, very special guest. I'll just do a brief intro. The Texas Society of Plastic Surgeons, American Society of Aesthetic Plastic Surgery, board member of St. Agnes Academy and Sisters Network Incorporated, Alpha Kappa Alpha Sorority Incorporated, Alpha Chapter. She has her own thriving private practice, ranked in the top 1%. You might have seen her on TLC, My 600-Pound Life. At Baylor College of Medicine, she was Resident of the Year. Graduated from Howard, magna cum laude. General surgery, plastic surgery, double board certified. That's a lot of money right there. Without further ado, I want to introduce Dr. Camille Cash.
Thank you.
Dr. Cash, welcome to the show. I'm so happy to have you.
Thank you. I'm excited to be here.
Man, so that's impressive. I mean, plastic surgery. I mean, where else? Double certified, general surgery and plastic surgery. That's amazing. So, tell us how a young lady like yourself. I know you mentioned earlier you're from Maryland and kind of Houston. How does a young Black girl from Maryland end up double board certified in one of the, in a specialty like that?
Well, it's funny, Josh. It actually kind of all goes back to Howard University, the Mecca. It really started me on this path. So I was born in Baltimore, Maryland, and I lived on the East Coast. My father worked for Exxon. So during my childhood, we moved quite a bit. We moved from Baltimore, Washington to Denver, Colorado, and then Texas, and then back to the East Coast, and then back to Texas. And so I moved every 2 to 3 years growing up. And I went to middle school in Baltimore. I had a fabulous time. It was just, great cultural experience. I was in, a very prestigious public middle school in the honors program, and everything was great. My mom went back to law school, and she had us, my brother and sister and I, campaign for Kurt Schmoke, who was the first African-American state's attorney. I think that's what it was called. It was like basically the district attorney for Baltimore. And we campaigned for him. He won. He eventually became mayor. And then he served as the dean of the law school at Howard University.
Wow. So you come from a family that you guys were doing it. So there's some pressure there to live up to.
Not a lot of pressure, just, what I think it was just exposure, quite frankly. My mother was a nurse. Originally, she had 3 kids, and then she decided to go back to finish a graduate degree, which is what she always wanted to do. But she put her career on hold to have the family. So I grew up watching her do what she needed to do and wanted to do. And so I guess that kind of set me on that path. We moved from Baltimore to Texas, where I went to high school. And let's just say I was eager to get back to the East Coast. And so during my senior year in high school, my mother and I decided to take a college tour of schools on the East Coast. And the first stop was at Howard University. And had a great visit. We met some friends because she had a brother that had gone to Howard's medical school, and we'd had some friends that lived in the area from years ago. And so my goal was to collect sweatshirts from every university that we visited. So we set out to find the bookstore for Howard, and then go on up to Princeton to New York. So we were on 6th Street, right across the street from the Quad. And, it's very busy with the cars coming in on the streets and with students passing by. And I was excited. We were, going over to the bookstore. So I was watching the traffic and kind of was like, okay, we'll cross the street as soon as this car passes. And I watched the car hit my mother. So I saw my mother get hit by a car on 6th Street in front
Wow.
of the quad. So yes, mom is still alive and well today. So that there, we'll give you that backstory real quick.
Wow. Thank God.
Yes, thank
Man.
God, because the story might have ended up very differently. But I'm 16, and I'm in Washington D.C., and my father is in Houston, Texas, and we didn't have cell phones, and that was at a time I didn't call my dad at work. So I had no idea really what his work number was. That was like only in nuclear warfare would we call my father at work. So I I'm literally freaking out. So I'm completely hysterical. My mom is alive. She's looking up at me, but she's laying on the ground and there's a little bit of blood, and I'm just like. So we get in the ambulance. We go to Howard Hospital. She's met by, of course, the great team of doctors. Charles Epps was her orthopedic surgeon,
Well, so
and
she went to Howard Hospital then.
yeah, because we were
Wow. Okay.
6th Street. We were right
Wow.
in front of the quad. So Howard was, of course, the closest hospital. So we went to Howard Hospital.
Man.
And I remember sitting in the waiting room or in the hallway and in the trauma area of ER. I don't know where I was. They took my mom into a treatment room, and I sat there on a bench by myself at 16, just seeing my mother get hit by a car. I haven't talked to my father. I haven't talked to any adult at this point. I'm just freaking out. While I'm sitting there, I looked over in a nearby treatment room, which was open. And there was a gentleman sitting there, and he had his hand on a Mayo tray, which is, a little doctor tray. And I could see that it was bloody and his hands were mangled and he'd been in some type of accident. And I just remember sitting there looking at him, and I said, I kind of forgot about my mom for a second. And I looked at him. I just saw my mom get hit by a car, and I just wondered, what happened to him? What happened to this guy? And what are they going to do to fix him? And so I was, at the same moment, I'm leaning in to look at the bloody hand to get a closer look. And something just kind of came over me and said, that's not really normal for you to be so intrigued by this man's mangled hand. But I was. And I found myself calming down and being distracted from the panic about what's happening with my mom and being focused on something completely different. And I had the wherewithal to say, that's weird. But maybe maybe I'm interested in being a doctor. And so there you go.
Look at
That's what
God. Look at
that's what's
God. God working in mysterious ways. He brought in a mangled hand, and there you go. I'm gonna be a plastic surgeon. So what happens after that? You have this, I guess, divine intervention. I don't know
Sure.
what you want to call it, but you see your mom there. Your mom's in the ER slash, our recovery room. You're seeing this guy with this mangled hand. All these thoughts are going through your head. What happens next?
So after that, my mom's doctor came out and spoke with me. I think I talked to my father on the phone. A family friend came and got me. And my mom was like, well, you just need to go ahead and continue on the college tours. And I was like, but you just got hit by a car. And I don't know, I'm going to Princeton, New Jersey, and to New York City. And so she basically just said, well, I'm okay. Your dad's on it. Your dad's flying to get me. You should just continue on. And because
Your mom is strong. That's a strong woman right there. He said, no,
so
baby, continue on.
continue on. So and luckily, we had friends. We had a lot of friends in the area from previous times. And so luckily, some of them were physicians and some of them were attorneys. And they basically put me on a train, and I took the train to Princeton, New Jersey, spent the night with some college kids there, went on up to New York to Columbia. And I saw one of my mom's close friends from college and stayed with her in New Jersey, and then flew back to Texas. And so, there it was. I knew I didn't want to stay in Texas for college. I was ready to come back to the East Coast, and so I got my acceptance to Howard and came to the Mecca.
So what are some of the schools that you visited?
So I visited on the East Coast. I had already visited Johns Hopkins, University of Maryland, Howard, Princeton, Columbia. And then also in Texas, it's pretty much, UT. Definitely wasn't going to be an Aggie. And then, of course, Prairie View was my first real experience at HBCU. So I'm the youngest of three. My brother and sister and I are all a grade apart. So my brother went to the University of Texas for a year and a half and had a really good time. Really, really.
Usually when you have a good time,
what happens when you have a really good time?
It's usually a short time.
Yeah. So he left the University of Texas, and after a year and a half, during my senior year of high school, so he's at UT my junior year of high school, and then my senior year of high school, he starts at Prairie View. And my sister, my senior year, is at Texas A&M for a year. So I got to go see the big state schools in Texas, and I definitely was not going to go to College Station in the 80s.
Mm-hmm.
No.
It's so Texas A&M was not an ideal place to be for people like us. Is that what you're saying?
It did not have that warm, fuzzy feeling, let's just say.
Yeah.
Austin was cool. So if I had stayed in Texas, I would have gone to the University of Texas. My dream school, I was torn. I knew I wanted to be on the East Coast. So Princeton and Howard were neck and neck.
Princeton, never heard of it. What's
it's Ivy League school in Jersey. It's real pretty.
I heard of it. I think
there's about 10 Black people in the 80s that went there. So it was cool. It was beautiful. It was prestigious. It's all of those things. I also looked at Columbia. Columbia was cool, but Columbia, I wasn't really ready to be in New York City. That was a bit of a stretch for me in the 80s. New York was, Columbia is very different now. Harlem's very different now, but I really felt DC was, close to my experience in Baltimore. I had a good support network. And so we want to talk about my failures. Another godsend was me not getting into Princeton.
Oh, you didn't get in?
Didn't get in.
Wow. What were you majoring in? What major did you pick?
When I came to Howard, my major was undetermined. Because although I wanted to be, I had just gotten this sudden interest in medicine. I had not been thinking about medicine at all. My mother had suggested that I become an engineer, and I was like, I don't even know what that is. I'm not driving a train. I just had no concept. So I liked math and science, but I also liked to write. So I was very strongly interested in journalism, and that was my kind of thought process, was maybe I will be a journalist, a writer, or the medicine thing's kind of interesting, but it's certainly very new for me. I went to Howard as an undecided major, and I was in the College of Liberal Arts, which it was called at that time. And I was undecided. And I took my first semester literature classes, Black women, Caribbean authors. You can only, at that time, you can only take that class at Howard. This is 1987, so we didn't have that at Texas A&M. I'm sure they didn't have it at Princeton, but that was just really exciting to take some of those classes and be exposed to culture and people of color that were doing amazing things in literature and science. And so I basically took a first semester just to have a good time, take a bunch of liberal arts courses. My second semester, I took chemistry, and I was like, okay, chemistry's cool. I still like chemistry. It's very math oriented. I liked math. And so I started the coursework for medical school just in case I decided that's the route that I wanted to go. But I wasn't 100% sold. And so I did, in between my sophomore and junior years, I did a summer program at the University of Texas Health Science Center and Baylor College of Medicine in Houston, Texas. It was a 6-week program for minority students to get them exposed to medical school.
Well, I have a question though. So when you graduated high school, how were your grades at that time?
They were, I guess, good, pretty good.
Pretty good.
I was in the top.
It had to be.
I was in the top 10% of my high school class. And the reason I know that is because I got automatically admitted to the University of Texas. So I think I was in the top 10%.
So it had to be a shock to the a hit to the ego not to get accepted into Princeton, I would assume.
You know what? I'll be honest with you. Yes, it was disappointing in one hand. And in the other hand, it was a sigh of relief because I was torn, 100% torn between Princeton and Howard.
Mm-hmm.
And if I'd gotten into Princeton, would I, because of the name and the prestige and the eliteness, would I have pushed to go to Princeton? So that decision was taken away from me, which literally was a godsend for me. I actually think, although I was disappointed, it was a very short-lived period of disappointment.
So fast forward, so you graduate high school. In your high school, what's the demographic makeup of your high school?
So there were 650 students in my graduating class, and of that 650, there were probably no more than 10 African Americans.
Wow, so you got 10 Black people graduating from your high school class. You don't get into Princeton, you come to Howard. What's that transition like when you get on Howard's campus and you seeing nothing but Black folks? What is that like when you first step on campus? Like first day?
Beautiful. It was beautiful. It's just beautiful.
Was your dad with you? Did your parents come too on that first day?
My mother came with me. It's so funny. I tease my mother. My mom came with me and helped me move into Howard. And then my mother never came back to Howard while I was there. It was a different time. It was more expensive to travel back and forth, but she basically dropped me off at Howard and said deuces and went back to Houston. No, it was because my sister and I graduated from college on the same day. And
Okay.
So she didn't come for my college graduation, but it was cool. It was fabulous. My sister and I are extremely close.
What's the music like? What are the people like? What's the energy like when you get long lines? Is long lines still back there?
Oh yeah. I remember being I think we were lucky because probably the freshmen got there a little early, so probably because the upperclassmen had already registered, so we get there a little bit early. And I remember going to I think it was Burr, and I remember being in line at Burr, and you had like a little, one of those little cards that just gets hole punched. You write. This is 1987, so there's no electronics, and you stand in line and you wait for your classes. And I think I got lucky because I was like interested in taking like really random classes. Like I told you, women in literature. I think I took 2 literature classes. I took a political science class, and I maybe took, I don't know, math. So I stood in line for whatever, 2-3 hours and got my classes registered. But it was cool because you're standing in line, you're talking to people. We had campus pals back then, so they don't have campus pals anymore.
I was a campus pal.
Oh, cool! So campus pals were awesome.
Yeah, no more pals though.
I think somehow I ended up with like 3 campus pals. You know how that is.
I'm sure you did.
Yeah. Yes. 3 campus pals. I was like, how did this happen? I think 2 of them overlapped. They were my official campus pals, and then a third one just, adopted me. But so they made it entertaining. You sat in line. We didn't know any better. It was fine. We just stood in line. But I think that, I had gone, you have to understand, I was in Baltimore before I went to Houston. So my 2 years in Baltimore were like very diverse. I was with people, different ethnicities, a lot of Black kids, a lot of not many Hispanics, but white kids, Black kids, Jewish kids, and it was very culturally diverse. But I'm also in Baltimore, and my mom's in law school, so she's president of the Black Law Students Society, and she's a little bit older, but all of her friends are, they're all Black, so they're attorneys. We're campaigning for the first Black state's attorney. So I'm surrounded by, Black people who are educated and are doing things on a very, very high level. So
nice.
Me stepping on foot at Howard, there was it was just like literally like you're home, like
So you
welcome
felt at
home.
home when you got there. That's good. That's
Oh
good.
my God. I
So
mean,
tell me about the luxury living accommodations back then at Howard.
so I lived on the second floor in Truth. And it was cool. I didn't have any issues with Truth. Truth was cool. We had community showers, but back then everybody had community showers. At UT, you had community showers. At Texas A&M, they had community showers. So the accommodations weren't bad. The only thing that was crazy, as everybody knows, is during the winter you had those radiators, right? And so then in your room, it might be 20 degrees outside or 10 degrees outside, and it's 150 degrees in your room. So you have to open the window to let some cold air in and some hot air out, which is so random because it's like freezing outside, but you're broiling in
Yeah, I
your
know.
room.
That's funny. That's funny.
Yeah.
So as a freshman, I mean, at this point, you're feeling at home. Life, you're getting, life at the Mecca is setting in. What are you're creating friends? Are you joining organizations? Are you taking leadership positions? Are you working on campus? What are some of the things that you're kind of, experimenting with as as you're on your own and kind of finding yourself?
So I was in student government in high school. And so that was kind of one of the first things I pursued. I was an officer for the College of Liberal Arts. I think I was freshman vice president or something of that nature.
Mm-hmm.
But I got into that pretty early on. That was kind of the first thing that I remember. I loved at Howard that we had in the College of Liberal Arts, you had to take a swimming class. You had to pass swimming in order to graduate. And you also had to take PE, right? So
Yeah.
which was not a big deal because I was a competitive swimmer all
Oh,
through growing up. I started swimming when I was in the third grade, and I swam all the way through high school, mostly on the leagues, in the summer leagues. So when I got to Howard and they were like, you have to take a swimming class, I laughed. I was like, okay, cool. And so all 4 of my PE credits were swimming. And I would go to the pool, I'd swim. I took lifeguarding at Howard, and I got my water safety instruction at Howard. So all of these were my PE credits, but they helped me get a job as a lifeguard eventually. So that was cool. I used to I used to watch the swim team. There were a bunch of Trinidadians, a bunch of Islanders. So I got to meet folks from the islands. I had never met anybody from the Caribbean before. But my freshman year was so much fun. It was so much exposure. I was part of the Texas club, so I got to hang out with my homeboys, my homegirls. But I went to college. I didn't have anybody from my high school come with me. And I knew a couple of people from Houston that were going, but I wasn't particularly close to them. So I got to know some folks from Houston and from other parts of Texas in the Texas club. Of course, I had my campus pal buddies. And my freshman roommate was dating a baseball player. So I hung out with the baseball players. And it was about I explored a lot of different facets of DC, a lot of different facets of Howard, different clubs, different organizations. I wasn't, like I said, I wasn't 100% sure about the whole medical school thing. So I joined the Charles Houston Pre-Law Society.
How were your grades when you were a freshman? Pretty good. Pretty good. Okay. Okay. So now when you do the pre-law society, what year is this? You still a freshman?
Probably a freshman.
Okay. So you're a freshman. So you're kind of looking at law and you're trying to figure out, what your focus is going to be. At what point do you pick your focus in terms of what you're going to try to pursue a career in?
So looking at the entrance requirements for medical school, you have to take 2 years of chemistry. And I was like, okay, well, 2 years of chemistry is half a degree. So that seemed like a logical way to go. Chemistry, it was like, well, if I don't end up going to medical school, I can work for a chemical company, or I can do something else with that degree. I liked biology enough, but that was not my desire to be a biology or at that time a zoology major. So I'm just kind of clicking out the chemistry classes because they're credits and I like it and it's cool. Chemistry, also being a chemistry major, you have to take calculus. So up to calculus 3. I liked math. So again, very, very cool. But I think I made the final commitment for medicine. Like I said, it was in between my sophomore year and my junior year of at Howard. And I went and I did a summer program back in Houston at the University of Texas Health Science Center and Baylor College of Medicine.
You said you had an internship?
It was a 6-week summer program. So
okay.
it was a you applied, you get in. It was specifically for minority students because then and now African Americans are underrepresented in medicine.
Why do you think that is?
I think it's because it's to get into medical school is hard. To stay in medical school is hard. And it's not because African Americans don't have the desire or the ability, but sometimes they don't necessarily have the support getting in, getting out.
Like, does a mentor come into play at this point? Is there somebody that you're staying in touch with that's kind of saying, hey, this is what you should kind of consider?
So my mentor actually was at Johns Hopkins, and that was Dr. Levi Watkins. He was a CV surgeon from Tuskegee, Alabama, which is where my grandmother lived. And so somehow my connections put me in touch with Dr. Watkins. And he, of course, was a pioneer of his own because he's a CV surgeon, cardiovascular surgeon at Johns Hopkins, which is one of the premier medical institutions in the country.
Mm-hmm.
And that was my mentor. He helped me navigate the process of writing my essays, helping me understand that you had to do well on the MCAT. At that time, there were several sections to the MCAT, and they were graded from 1 to 16. So your goal was to get like a 12, 13, double digits, as we would say, or higher, the best that you could. And so I think there was an awareness that I had that I have to do well on the MCAT. I took it one time. It was the worst exam I've ever taken in my life. It was so tedious and exhausting, and it was very demanding. But that's what you have to do to go to medical school.
You decided, at what point did you say, you know what, I want to be an AKA? When is that?
Well, my mother's an AKA, so
okay.
There's that.
So mom's an AKA. Okay, so I could understand the
yep.
pressure or the influence, to be an AKA. And you're at Alpha Chapter. I mean, were you aware? Like, was this a conversation that moms had, not necessarily with you, but is it when you walk into your mom's house, is it obvious that she's an AKA?
No.
Okay. What about growing up? Are you surrounded with these strong women?
Yeah. So because we'd move, so you have to understand, I would move every 2 to 3 years.
Mm-hmm.
So my mom would move every 2 to 3 years.
Mm-hmm.
So that meant she had to make new friends, just like we did. And so, of course, Alpha Kappa Alpha was always a support network for her.
Okay.
So on Saturdays, one Saturday a month, I remember very distinctly in Denver, I was young. Saturday, my mom would be gone all day long. I don't know if the sorority meeting lasted all day, but she would just be gone all day. And we'd be at home with my father, and he'd cook for us. The food he would cook would be terrible. But, at that point, we didn't go out to eat, right? That was not what you did back then. So we would just eat Dad's cooking, and we'd swallow it down. But I do remember that was always her outlet. That was her connection.
So what was Greek life? Well, think like, I know Howard. I went to Howard 99 to 03. So, obviously I have an idea of what it's like to want to be Greek or be Greek and what that scene is like. What was it like back when you were thinking about becoming a member of Alpha Kappa Alpha? What was this, your sophomore, junior year? When is this?
So I get to Howard's campus freshman year, and I just remember I had no idea about Greek life. I had no expectations going into college. That wasn't part of my decision making to come to Howard. But I distinctly remember becoming aware of Greek life, of course, during homecoming.
Mm-hmm.
And in 1987, the AKs had a legendary step show performance. Legendary. It was one of those moments where, I'm a freshman and I'm like, oh my God, that's so cool. They're bad, just the showmanship was incredible. And I don't think the AKs had won a step show in a number of years, so it was a big deal. But it was just phenomenal performance. But then you find out a little bit more about the women that are in the chapter. So it's not just about they're pretty and they step, but these are women that were Miss Howard, Miss College of Liberal Arts. They were leaders on campus. And so this was a group of women who clearly knew showmanship, but they were also hardworking leaders in the community, on the school. So I'm coming from a whole family, an experience of strong Black women. So of course I want to surround myself with like-minded women. So it certainly was a no-brainer for me to see the continuity of the strength and the sisterhood and the support from throughout the entire my entire childhood from my mother with Alpha Kappa Alpha. So when I get to Howard, I didn't really appreciate that it was Alpha chapter till I got there. That, like I said, it didn't factor into my decision making. But once you get there and you realize just the history of Howard University, the history of Alpha Kappa Alpha Alpha chapter, of course, this is Felicia Rashad, Toni Morrison. Those were icons that had, pledged at Howard University.
What does that mean to be a member,
Oh,
of not just AKA, but the Alpha chapter,
Well, I think it's fabulous, and and I'm an AKA and I went to Alpha chapter, but I think it's huge for any member of the Divine Nine. I really think that whatever it is, if you're a Delta, if you're a Alpha, Q, Kappa, that rich history and legacy is just, and the sisterhood or the brotherhood that you have is really something that is amazing, that will support you and sustain you throughout your entire life. So for me, it was like, I didn't know anything else other than this is where I am, this community of Howard University, Alpha Kappa Alpha, something I want to be a part of. And then there's a process, as you know, of making line and everything else. And my freshman year, I was like drooling, like, this is what I want to do. Sophomore year, Alpha Kappa Alpha sorority nationwide had a moratorium on pledging. So there was no lines in the entire country in 1989. So I just had to sit and wait another year. So junior year was when I had the opportunity to pursue and to pledge Alpha chapter. And even then, even pledging and going through that process, you knew you were excited. You knew you'd found a new group of sisters. But it's 30 years now that I'm about to celebrate the anniversary of my sisterhood and pledging. And it's through the years, through the 5-year, 10-year, 15-year anniversary, 20-year, where we have this connection, this sisterhood that is endearing to this day.
What's the next phase in terms of your career?
So I'm going straight to medical school. I'm moving back to Houston.
And that's Baylor. You went to Baylor, right?
To Baylor College of Medicine. So completely different institution from Baylor University in Waco. The Baylor Bears are completely separate. But I'd been in DC for 4 years, loved it, was kind of ready to go. As I said, if I'm going to go to medical school, it's going to be hard. I would like to have some support, a little bit of support around me. And I had the opportunity to stay at Howard's Medical School and Columbia, but Baylor offered me pretty much a full scholarship.
Was there like any type of culture shock or anything like that when you got to med school, making that transition from Howard to Baylor?
Oh, it was huge. That was a huge transition. I think it was not just huge because of there's 137 students in my medical class, 137. There were 5 African Americans. And I came in like, I got this. I'm cool. I'm smart. I'm ready. I know it's going to be hard, but it's fine. It's good. I saw my mom go through law school. You just work hard and it'll be okay. And you get to medical school, and that was the first time I literally got my teeth kicked. It was so
Really?
hard.
Was that tough?
Very hard. I always, there's an analogy that going to medical school and learning all of the sciences is like drinking from a fire hose.
So what about Howard? The stuff that you learned at Howard, did it not translate? Or were you just a big fish in a small pond?
Everything I learned, everything, and it wasn't just Howard. It wasn't just me coming from Howard. It was every student. We had students that had a master's degree in biochemistry. And after 2 weeks, everything they had learned in their master's program, we'd already covered. So it wasn't a matter of being prepared or not. It's just that you're learning so much new material so fast that you don't have time to digest it. And it's coming fast and furious. And there was a young lady who worked in the Learning Resource Center, which is basically the library. She was Black. And she would try to look out for us because I also got to Baylor, and I realized it was very cutthroat. It was very student unfriendly, as I like to say.
What can be cutthroat about learning?
Oh, well, some of these students would take books out of the library and check them out and never return them. They'd hide books.
Oh, that's petty.
That's
petty. But I'm sure being online for AKA, you probably was built for that.
So you learn, and I watched a number of the African American students leave. They didn't make it through. The hardest part of medical school is the basic sciences. It's the first year and a half to 2 years. It's where you're learning anatomy, physiology, pharmacology, and you're in the classroom and you're learning. And it's very, very high pace. It's very, very stressful, and it's just a lot of material. And so and that's why a lot of people have a hard time during their first couple of years of medical school. And that is truly the make or break time for medical school. If you make it through basic sciences, you can make it through the clinics.
So, okay. So obviously you made it through, but was there a point where you wanted to give up, or you wanted to quit, or maybe not you wanted to quit or give up, but a point where you doubted yourself and maybe felt like, man, I'm never going to make it?
I'm sure there were moments of major doubt. During biochemistry was my Achilles heel. And I was, I liked science. I did well in science. I was a chemistry major, but biochemistry was just a beast. And that was the class that was the hardest for me. But fortunately, it was the first semester. And once I made it through, I was good. But that first, just like anything, the first semester is the hardest. It's a transition. It's a culture shock. Oh wow, this is a whole different level. You don't feel particularly supported. I didn't feel any significant camaraderie with my classmates. I did for a short period. I used to go to Texas Southern, HBCU. I used to go to Texas Southern's law school and study with the TSU law students. And I felt more comfortable and more support from them, even though we were in totally different schools and totally different professions. So I would go there to get some energy and help.
How do you stay level-headed in at that point and not go crazy? That just seems like a lot of the same thing.
Well, I went to church. I went to, as I said, I continued to swim. So that was a little stress relief.
Mm-hmm.
Swim. And then I had, like I said, my parents were here. One of my best friends lived here, and so I had that support.
At what point do you pick a focus
You
that you're
pick a
gonna?
focus typically, so a year and a half of classroom for me at Baylor. Most schools are 2 years, but a year and a half. And I knew pretty close to the beginning of medical school, I had done a rotation in surgery with the orthopedic surgeon. And I really liked that. That was cool. I liked anatomy, loved anatomy. So anatomy was my favorite class by far. Learning about the body, learning the different parts, dissecting the cadaver. That was really intriguing and interesting for me. So I'm interested in anatomy. So I'm thinking, okay, I kind of like surgery, but surgery's
Cadaver, these are dead bodies.
those are dead bodies.
Oh my goodness.
Those are the dead bodies that are the families.
What is enjoyable about that? Name one thing.
Well, you have to understand, the families have donated their loved one's body to science, and it gives you the opportunity to learn the anatomy of the human body. So it's a little morbid and a little gross. I get it. But wouldn't you rather me learn where your spleen is and what blood vessels are attached to it on a dead body before I go to surgery and take your spleen out?
Oh yeah, 100%, 100%.
Yeah, you'd appreciate that. So even though it's morbid or gross, again, medicine's not for everybody. And anatomy, that was just very, very cool for me. And we were very, very respectful of the bodies, so we kind of focused on the anatomy and everything else. But
It sounds like you had a passion for the medicine. Would you say that you have to have a passion for medicine to finish med school?
I think you have to have something that you fall back on in the times of anxiety and great stress that makes you want to keep going. It's like blind faith, blind conviction. So yes, you could call it passion, because medical school is one part. And so there was never a point in medical school that I thought I was going to quit. The wanting to quit came later. The wanting to quit came during general surgery residency.
Okay, let's talk about that. So residency, where are you doing your residency at?
So so let's talk when we're going to back up a little bit, because during medical school, I have developed this interest in surgery. Okay, there are 0 Black female surgeons in the entire medical center. Okay, there's
0. So they're looking at you like she's not going to make it.
0. There's probably
there are
one or
zeros. There are a lot of zeros when you get paid.
there can be. There can be. There's 0 women, 0 Black women. There's like 1 female, period. She's a pediatric surgeon. There was 1 Black male surgeon who was leaving Baylor to go someplace else. So there were very few role models, but that was my interest. And I knew that I wasn't going to probably be able to stay at Baylor to be a surgeon, because there were no Black females ever. Mm-hmm. There are no women. There's like 1 Black person. So but I really kind of thought I liked orthopedic surgery. And then somewhere in my junior year, a Black male orthopedic surgeon comes to Baylor. I forget where he came from. And he became my mentor. He helped me do some research. We did some research together. He gave me some very sage advice. But we knew there was no chance I was going to be at Baylor, because that's fine. But part of me, so you're and you start doing your clinical rotations in the different specialties, your 3rd and your 4th years, and you apply for residency your 4th year. So orthopedic surgery was very interesting to me, but there was always a little bit of it's just not quite right. There was something about it. Maybe it was, very much a good old boy community, and I enjoyed orthopedics more than I enjoyed any other type of surgery. But I liked surgery. I looked at ENT. I looked at, urology very briefly. Anything surgical, I was interested in. All right, and I tried to at least give it the benefit of the doubt. And I just kept coming back to orthopedics, but I wasn't 100% sold on it. But I applied. It's extremely competitive. You had to be in the top like 1% of your class, which I was not in the top 1% of my class, to be pretty confident that you would get in. So in medical school, and when you apply for residency, you basically interview and then you rank the programs by preference of which ones you want to go to, and then you get thrown into a system where the programs rank their applicants, and it's called what a match. The computer matches you up based on your top pick and their top pick. So when you talk about failures, one of the things that my first significant failures was I didn't match an orthopedic surgeon.
Wow, really?
Because I interviewed in Boston, but and I understand that the Boston, you're not supposed to recruit people. It's supposed to be very hush-hush, but I understood from my mentor that the Boston folks were very interested in me. But I'm not going to Boston because my future husband can't come to Boston, and I'm not going to go to Boston. I'm not going to be in a strange city with no support, no husband. I wasn't 100% committed to orthopedics for that.
So I didn't match. Did y'all get married?
Yeah.
Oh, okay. Just making sure, because that would have been all bad. Okay. So
that was a failure. So I was probably one of 5 to 10 people in my class that did not match.
Oh man. So you do all of this,
research,
all of this
applications,
research, studying, networking, potentially taking out loans, all that stress, all those parties you missed, everything that you missed, and you don't place. Does this create any type of friction with you and your would-be husband?
No, because I knew that going in, and I knew that if I said yes to him and this happened, there was no way that I could hold this against him. It was my decision. If I was going to hold it against him, I shouldn't say yes to get married.
Wow, that's deep. That's deep. So what happens? I mean,
so it was really interesting. I really wanted to go to Galveston. I was telling my mentor, please get, tell the folks at Galveston, I really want to be there. It would have been perfect. I would have been in orthopedics in Galveston, and my husband we'd be together. We already looking for houses. And you go on match day. It's the Ides of March 12th, I think. And everybody goes to their mailbox. All the students, you go check your mailbox. And if you get a note in your mailbox telling you that you didn't match, you have to go to the dean's office. If you don't get a note, you've matched, you go to the courtyard, and there's a whole bulletin with your name and where you matched on it. So I go with my fiance, we go to the mailbox, and I pull out my mail, and I'm going through my mail, and I'm like, I didn't get a letter. I matched. I'm so excited. And he shows me the piece of paper that fell out of my mailbox that says I didn't match.
Oh, man.
So
that's like
I go,
bursting your bubble for real.
Big bubble bust.
Damn.
Big failure, right? But it was a calculated gamble. And I said, okay. I knew that this was a strong possibility based on the fact that I limited the places that I was willing to go. I went down to the dean's office, and I talked to the dean, and the dean asked me, what do you want to do? And I said, hey, can you see if you can get me a 1-year spot at a general surgery program at St. Joseph's, the private hospital? We made some phone calls. I get a 1-year spot in general surgery. And I said, okay, I'm going to do this 1 year of general surgery. I'm either going to reapply.
Is that paid when you work there?
Sort of. Yeah, you do get paid, but you don't get paid.
You sort of get paid.
You get money. Yes.
You get a wealth of knowledge.
I think I probably my first my intern year, maybe I got $29,000.
Okay, that's enough to get to work and get back home and get to work again. Okay.
Yeah, that's pretty much what you did. So I basically accept a 1-year spot in general surgery. It's only for 1 year, and I'm gonna have to reapply. I'm gonna either reapply for ortho, or if I like general surgery, maybe I'll do general surgery. It's unsure. So I'm like, I've got 6 months to think about it. So I graduate from medical school. 5 days after I graduate from medical school, I get married. It's just, I feel like this is fate. This is what it's supposed to be. I made my decision, however the chips fall, that's how it's going to be. So I start my residency July 1st. And then 3 months into my residency is when I do a 1 month rotation in plastic surgery.
I thought you was gonna say I was pregnant. I was like,
No,
man.
that came later. That comes later. It comes later.
Okay.
I do a 1 month rotation on plastic surgery. And I decide right then and there, this is what I want to do. That was my second aha moment.
And the
This
first
is
hand, the mangled hand.
mangled hand.
So he's like, mangled hand. That's what you thought. He was like, I knew it. Okay. So
My aha moment.
got it.
I did a month of plastic surgery, and I said, I love this field. I love it. I'm excited to be here. This is what I want to do.
Mm-hmm.
So I spent the next 4.5 years making sure that that's what I could do.
Wow. Okay. So that's a lot to unpackage there, but obviously you finished that program. And what school is that? That's at St. Joseph, you said?
So that's at St. Joseph. So I've left Baylor, and I'm at this hospital, and it has a private program in general surgery, and it also has a private program in plastic surgery. So at that time, there were very few programs in the country where you would go straight from medical school into plastic surgery. There were very few programs. Most programs you would do 4 to 5 years of a surgical residency, then apply for plastic surgery, and then do your plastic surgery training on top of that.
And can you just break down what is a plastic surgeon? Because when I think about plastic surgery, I'm thinking like Kardashians, I'm thinking LA, Hollywood. What is a plastic surgeon?
So there's different subspecialties within plastic surgery. So plastic surgeons basically are surgeons that reconstruct and restore body parts or function. So aesthetic or cosmetic plastic surgery is a subspecialty within plastic surgery that deals strictly with making cosmetic surgical improvements to patients. So there's a whole group of plastic surgeons whose life work is dedicated to reconstructing patients' hands after trauma or burns, surgeons that are reconstructing somebody's face after being attacked by an animal, or being in an explosion in war, or in a car accident, women who've lost their breast to breast cancer. There are surgeons whose whole life, that's their life's work. There are surgeons that are dedicated to children who are born with congenital abnormalities, like a cleft lip or cleft palate, or brain fusion, or different types of congenital issues. So cosmetic plastic surgery is what I've gravitated to through the years, but that's not all that plastic surgery is all about.
So what's general surgery?
So general surgery is basically you're doing trauma surgery. So I did trauma surgery, oncology surgery, where you basically cut out cancers. A lot of surgery of the abdominal and chest cavity. So you're taking out gallbladders, spleens, kidneys, parts of your intestines, fixing hernias. Now another field within general surgery that's exciting that developed as I was finishing is laparoscopic, or minimally invasive surgery. So that's bariatric surgery has become very, very popular. So weight loss surgeries.
Oh, okay. Now, break it down for me.
Sorry, weight loss surgeries.
I was like, what is that? Okay, because that's why you're on that 600-pound
life. Yes.
What was that? My 600. My wife watches that show.
It was a spinoff from My 600-Pound Life, Skin Tight.
Wow.
So it would follow patients who've lost a major amounts of weight loss, and then they present with all this extra skin, and then the challenge would be to remove it.
Because I want to talk about that later. So you graduate, you finish your residency, but from what I understand with medical school, you still got another hurdle. You got to go get board certified, right? Mm-hmm. So you get double board certified. Is this something that happens simultaneously, or how does that happen?
So I did a 5-year general surgery residency. So not everybody who becomes a plastic surgeon does that, but I finished all 5 years, and I became what you're called board eligible. So if you finish after 4 years, if you do only 4 years, you're not board eligible. So I decided I was going to sneak in and have a baby during my chief year general surgery because it's a little bit less demanding. And that allowed me to finish general surgery, have a baby, be board eligible in case the plastic surgery thing didn't work out. So I complete my training in general surgery, and you have to take exams to become board certified. So more exams. It's never ending exams. So you take a written exam in general surgery. I took the written general surgery exam when I was in the first year of my plastic surgery residency. So I'm in training, but I'm taking my board exams. Then you take your oral exams if you pass your written exams. Then you become board certified.
How was it being a woman and, you know, having these type of career aspirations, especially because, you know, especially when you know, and I ask that specifically because you're giving birth, which is not it's a blessing, of course, but, you know, traditionally, back then, I would assume that, you know, men are more breadwinners, you know, maybe not now, but what is that like having to juggle being a mom, but not just having a job, but like having a stellar career?
So it's a lot. I mean, I picked, my husband picked me, but I picked the right guy because he was okay with waiting. I got married, but I didn't even think about. I knew I wanted to have kids one day, but I didn't have any great dying maternal urges or baby desires at that time. I wanted to be a surgeon, so that was first and foremost. And so I decided to wait to
So is
have
that is
children.
that is that something that you guys were actively talking about? Like, hey, I'm not ready yet. You know, I got to get
Yeah, I mean, he
get
knew
this
he knew
milestone.
that
Okay.
he knew that it was a 5-year general surgery thing, and I wasn't, it wasn't even possible. I spent 100 plus hours a week at the hospital. So there was no way in my mind that would be an ideal time to have a baby.
Mm-hmm.
So we waited until there was a point in my residency where I didn't have to spend the night in the hospital. So the term residency, a resident, you're a resident because you basically reside at the hospital. So I came through in a time where we would work 100-hour days. I mean, 100-hour weeks.
Do you learn more as a resident or when you're in med school?
You learn about medicine and all facets of medicine in medical school.
Mm-hmm.
You learn about your career during residency and then beyond. So
like,
it's different types of learning. So
you
you
like
hone it.
applying it when you're in residency, kind of.
And a lot of the basic sciences that you've learned become very, you use it, but very limitedly. Like, okay, gram-negative bacteria cause this type of surgical infection and this kind of antibiotic we have to use to treat it. And the pharmacology works like this. But those are little things that you learn. But you really learn how to be a surgeon by doing surgery.
Okay. At what point do you actually feel like a doctor? I mean, I know you're going through this whole process of becoming a doctor. People calling you doctor, but it's got to be a moment where you're like, hey, I'm the person in charge. I'm the smartest in the room. Like what at what point is that?
I think you start becoming a doctor you become a doctor the day you graduate from medical school. You start earning the title during residency, when you are making sometimes life-saving decisions. And you may not be the smartest one in the room. And if you're smart enough to know you're not the smartest person in the room, you'll know that you should ask the nurse for help because the nurse is sometimes the smartest person in the room.
Wow. That's interesting that you say that, because I know nurses work a ton of hours. They kind of like the glue, sometimes in the in the medical field. But that's good that you say that.
I set up my own practice right away, and I needed money and needed capital.
So right away, you mean you didn't work for like a hospital? Wow. So out the gate, you came up with your own practice. And if you can ballpark, the type of startup capital needed to do something like that, I mean, what would you say is kind of?
What I started with was a shoestring budget. I started because I office shared with 3 general surgeons. So we'll back up a little bit. I have baby number one strategically planned to the delivery during my chief year of general surgery. Perfect. Nobody saw me pregnant when I was interviewing for plastic surgery. I imagined plastic surgery before anybody knows I'm pregnant. I have the baby, and then I'm going to be finished with general surgery, and I'm ready to start plastic surgery.
Do you
But
think if they would have known you were pregnant, you think that could have hindered some opportunities? Wow.
I know that. I know that for a fact, based on questions that people are not supposed to ask you when they interview you, but they still do.
Okay. Good to
So
know.
no.
Remember, so when a lot of these questions I ask, so that people, it puts something, on their head when they watch this.
So my mentor from orthopedic surgery back at Baylor, he told me, like I said, some sage advice, and he told me these are illegal questions. They're not supposed to ask you if you're pregnant, if you're planning on having children. They're not supposed to ask you that. And he said, if they're bold enough to ask you those questions, you should be bold enough to lie.
So you had the nerve to be a surgeon, number one, and you got the nerve to open up your own practice. That seems frightening because, number one, it would seem like the typical path would say, I'm gonna go work in this hospital for a few years. I might work under somebody else, try to, get some relationships with vendors, suppliers, other doctors, see how this insurance thing works. But out the gate, you're starting your own plastic surgery. I mean, you're a Black woman. I'm assuming, and I could be wrong, do most of your customers, do they look like you and me?
I would say about 40 to 60%.
Okay. So, I mean, just being honest, I want to, I do want to, when I go to the doctor, I do prefer to go to a doctor that looks like me, just because I would think that that person kind of understands me a little bit better, even though internally we're all the same. But plastic surgery, that's at least to a novice. When I think of that, I think of external repair work being done. I mean, what gave you, I mean, again, shoestring budget, even still for plastic surgery, shoestring budget got to be a lot of money still.
So you have to, when I started, I graduated from residency. I finished my residency in 2002. I didn't want to start my own practice. I interviewed with I approached a couple of plastic surgeons in the area about joining them. And at that point, I had 2.5 kids. I was pregnant with the third. Nobody knew.
Oh man, 3.
I had 3 back to back. I only planned the first one.
So you had a good social life. You made up for
Yeah,
all that.
We
all
made
that
up.
other time. Y'all made up for that.
For it. We made up for it. So I remember distinctly talking to a particular surgeon who had a group, and him asking me point blank, "Are you finished having children?" And I said yes. I think I was pregnant, but I said yeah.
Well, let me ask you this: as a business owner now, can you appreciate a question like that?
Yeah, I can appreciate it, but I would follow that up. In fact, I think it's important. I think it's important for women to be able to have the conversation with their employer. I don't know that it's possible, but in an ideal world, I should be able to say, yes, I would like to have children. I would like to have children, but I still want to be a surgeon. I still want to operate, but I also want to have a family. And this is how I think I can do both.
Mm-hmm.
Instead of just automatically being dismissed that you'll never be good enough, you'll never work hard because you're always going to be, a mother. I think that it's important for people to. I think the conversations are changing because the millennial desire for work-life balance is real. And I don't think that there's anything wrong with a balance. But it's a conversation. So if I have a woman that's interested in going into medicine and they're looking for my advice, then I say, well, how are you going to factor what's your plan for your family? How are you going to make that work? And I think that I got a question like that from my program director in plastic surgery. He asked me point blank, how are you going to make it work? And I said, this is how I'm going to make it work. And he said, okay, that's fine.
So it sounds like he was asking not to discriminate, but really to make a good decision about if he should work with you. What,
Correct.
let's say you're not married, but you do have these 3 kids.
Ooh.
What is that? How, like, talk about how that can be a huge hindrance.
Being a single mother with children and being a surgeon. Yeah. Okay, let me just tell you this. I'm married with 3 kids. I had 2 sets of grandparents. I had a live-in nanny. I had friends and family. I had an entire village of people helping me with my career and with my family. I had people that would help me with my kids so that I could manage my practice and my career. I didn't set out to start my own practice right away, but nobody wanted to hire a Black female surgeon who had 3 kids in 2002. Nobody.
So you never got hired from anyone?
Mm-mm.
Wow. Never got hired.
And I might have, and there might have been opportunities, but again, I didn't want to move. I didn't want to leave Houston because I had 2 sets of grandparents in Houston, so I wasn't going to move.
Right.
And so I did. I had a tremendous amount of support. And then I'll just be quite frank, I busted my ass because I was still wanted to be present in my kid's life, but I still wanted to be a surgeon.
Wow.
And I don't think that's mutually exclusive, but I will tell you, it's a lot of work.
So you can do both, but you gotta.
You might not sleep.
Mm-hmm.
You know.
So what I'm hearing is that, it's one thing to want it, but your life was set up for that. You were intentional about a lot of these things. I mean, even you're cognizant of the fact that hey, I got 2 sets of grandparents.
Correct.
You're thinking all of these things through. And like a lot of entrepreneurs and people that are creative, it sounds like you were forced to be creative when you didn't get in the initial residency. You had to ask for that other opportunity at St. Joseph's, and then not even getting a job offer or the job offer that you wanted out of residency, even though you certified and everything else. You were kind of forced to go this route, which probably you don't regret.
No.
Is that right?
No, don't regret it. I
Yeah.
don't regret it. It's hard work. It's not easy.
When you open doors, how are you building your customer base?
So when I started my practice, this was before websites. So funny thing was, we would advertise in the yellow pages back in the day. And I started at the very tail end of yellow pages. I think I had yellow pages for 1 year and that was it. Then we were building our website. Then it was word of mouth. I would do ER call. I would work with some of the Black physicians. General surgeons would feed me cases. Infectious disease doctors would feed me cases, even if it was like a bed sore that needed a flap to cover it. Whatever it was, they would feed me cases. And I started off very modestly. So I started off office sharing with 3 general surgeons. So basically had clinic 1 day a week. I also had 3 small children. So I built gradually and slowly. I worked with one of the established dermatologists. And then when it came time for websites, then print media was huge for plastic surgery. And so at the
Or
same time,
like brochures,
magazines.
mail. Oh, okay,
Magazines. So there was a health and fitness magazine that was like full of fitness advertisements, but also that's where the plastic surgeons would advertise. And so I said, okay, what makes me different? I'm a Black woman. I want people to know that. So I was in all of my ads
So you
as
use
I'm
that
Dr.
to be
Cash.
an advantage.
Yes.
Okay.
Yeah. I made sure at that time that people knew that I was a surgeon, but not that I was a woman. Not that I'm just a woman. I'm also extremely good at what I do and very well trained and unapologetic.
Wow.
So
So
we had print media that was good for that.
So was internet, like the advent of internet, and was that a game changer for your business?
I think it's a game changer for a lot of people's business, but it certainly we started putting more energy into website and SEO and development. And then of course, all the things that come with it, pay-per-clicks, which has never been a big deal for me. Then we start doing, we were doing a lot of internet and print at the same time. Slowly but surely, social media, of course, has become a major way that we communicate and advertise. And it's huge. Obviously, I did a reality TV show for a year that really I was able to showcase my talent on a network-wide basis, and then it just feeds into itself. So reality TV was a great opportunity for me. You don't get those opportunities unless you have good skills, good results, good outcomes, and a good reputation.
For you to be a plastic surgeon, you could at least go in and work for somebody, still make excellent money, and not have that, have to worry about the business side of stuff. So I'd imagine, you are the face of the business. It's not like people just come into your office like, hey, I saw y'all hiring for a plastic surgeon. Can I help? Like, what was, financially, what was that like for you in the early stages of growing your brand and starting your business?
So early on, I didn't sign a contract to make X amount of dollars. So like all entrepreneurs, I didn't know how much I was going to get paid. So I'm starting my practice. I have young kids at home. I did some independent contractor work. So I would do physicals for the TxDOT, so the Department of Transportation. I would do their physicals for the drivers. I'd get paid an hourly rate. And my husband would be like, he's like, I got airplane mechanics that have a high school degree that are making more money than you. And I'm like, yep, but at least I know I can go work from 9 to 5. I have this amount of money. I can put that in conjunction with what I'm building. So it was humble beginnings. I did what I needed to do because I figured that even if I could just match my residency salary, which was not a lot, we're talking about $35,000, $38,000, $40,000. If I can match that salary, then at least I know what I'm working with. And I had no interest in taking out a $500,000 business loan.
No interest.
Yeah, I mean, that would be great. I think I paid myself twice what I was making as a resident. I was able to do that my first year.
So you didn't finance any part of your business?
I did. I financed it. I probably took out, I know it was maybe, let's just say $50,000 loan.
Mm-hmm. So that is extremely modest in terms of for what you're doing.
Because I office shared. I basically hired. I got one phone line. I shared a fax. I shared a receptionist. I answered my own calls. I saw patients 1 day a week, building my practice.
Who told you to do that?
I think I was fortunate. Okay. I had some fairy godparents that had trained me in general surgery. They had wanted me to join their practice as a general surgeon. Mm-hmm. But of course, when I went into plastic surgery, they offered me the opportunity to office share with them. Mm-hmm. And so that was extremely generous. I had a place where I could see patients, which was minimal fee. I used their office manager to help with billing. They introduced me to their banker who bankrolled my first loan and helped me qualify for the PPP program that we just, with COVID-19.
Yeah,
so
I did that too.
Yep. So when you have you have to have strong banking relations, and that saves businesses.
What would you consider like your big break when you say, man, okay, financially, this was worth it?
It took a long time. I'll be really, really frank. So I didn't graduate and just start balling. I think there are different types of opportunities now, but my big aha, I got this was 10 years in.
10 years after residency or after being a business owner?
10 years after residency.
Wow. That's a lot of blood, sweat, and tears.
Yeah. It's a long time.
And was that
That was when I was able to buy a medical building to house my practice. Yeah.
So 10 years in, is this because you're just a better surgeon, or is it because you're a better business person?
It's because my volume, my reputation has grown. You know,
Mm-hmm.
when you come out, nobody knows who you are. So you have to work and you grind a little bit. You grind, and then you build a steady, you know, stream of patients. Patients refer friends and families. You do media
Mm-hmm.
and things of that nature, and you just always do good work.
Wow. So this is like 20 what? 2013?
Probably
2014?
2012. 2012.
2012? Okay. So 2012 comes, and this is only 8 years, from now. So 2012 comes, things are starting to click. You're getting the referrals that you want, and you're probably able to kind of pick what type of customers or what type of things that you're going to deal with at this point. You're not doing the scabs anymore. You're doing, you
Yeah.
know, more, you know, complicated type of things. So in your business, what would you say, um, what would you say has kind of changed in medicine since you first started, until now? Like, we talked about the internet, but like if you're coming in as a medical student or someone that wants to one day have their own practice, what do you think the biggest changes are?
I will tell you, having a solo practice is going to be very challenging for people in the future. It's very expensive. And it's technology has changed, which is amazing. So, we've got electronic medical records, for example. We don't have to do paper charts anymore. We've got different products. We've got different lasers, different devices that can do skin tightening, fat reduction, muscle toning. So it's a matter of figuring out which one works better. It's just, the residency programs. You don't have to work the same number of hours that we
Hmm.
used to. That's nice.
So do you spend more time now working in your business or working on your business?
I spend the majority of my time working in my business, but I do spend a lot of time working on the business. And it has to be intentional. And you have to surround yourself with good people. And so it's taken me years to develop, to get a good staff, a support staff.
Can you talk about that, like the importance of building a team and what type of things you look for? Because as your brand grows, you got to be intentional about those people that are that,
That
that are that are representing you.
I think that's one of the biggest challenges of any of of my business, maybe not any business, but for my business, it's staffing and finding the right staff. Um, and it sometimes it's luck, sometimes it's right timing, because you may interview somebody, you may think that that person is a great fit, and then you put them in the position and you find out that they don't always have your best intention in mind,
Mhm.
or they don't have the same work ethic.
How
And
big is how big is your practice now?
so I currently have, I think there are, so I've had myself, I've had nurse injectors, I've had a nurse practitioner, I've had an esthetician. So I have an esthetician and myself in the practice now, and then I have 4 other support staff.
Okay, so you're the only doctor, or so, okay, all right. So, and this is, as we come to a close, I would like to know, as a black surgeon, are you conscious of that? Uh, when in your business, at all, and what has it been a hurdle to generate to I guess drawing in business?
I think there's always a hurdle. There's a hurdle for all people to find good staff. We're not a corporation where we can train people and then you put them in HR, blah blah blah. We're a small practice, so um, it's a challenge. I've had some people that, quite frankly, are jealous of me There are other people that don't want to work that hard, or there are people that don't get your vision. They don't understand customer service. They don't understand I have to do everything better than who's next door to me. I can't leave myself open for criticism. So that means the phones have to be answered. That means my technique and my surgical outcomes have to be as good, if not better, than my peers. We have to do everything a little bit better.
What's next for you? I mean, reality show, I'm sure that was a huge deal for you. I'm sure that was pretty cool. But being double board certified, the first African-American female in the state of Texas to achieve this distinction, what's next for you? Because you've only been at it for 10 years.
Well, no, I've been at it for 18 years. I just feel like my big breakthrough was 8 years ago. But I would say that the thing is, you can never stop. You can never get comfortable. You can never say, well, I've arrived, so let's just coast, right? Yeah, you got to keep grinding. You got to keep working. And so for me, what am I going to do? I want to do, well, COVID-19 kind of has derailed some plans, but every year it's how can I do better than what I did last year in terms of revenue, in terms of work-life balance, in terms of next things, So we're going to regroup from COVID-19 and how it's completely altered and changed everything for everybody. And we have to figure out how we're going to survive and thrive, not just survive, we have to thrive. We'll figure that out. I'm confident. I'm going to continue to do great surgery. I'm going to continue to embrace new technologies that I think that are relevant for my field. I'm going to continue to reach out on social media and embrace those technologies and those opportunities. It's just more work. So it's funny. I have 2 kids in college now. And part of, I think, the slower ramp up for me, I'll be honest, part of the slower ramp up for me is the fact that I had children. And so, yes, maybe a man would have ramped up maybe in 5 years, and it took me 10 years. I had 3 kids, and I don't regret that. I don't regret being present in their life growing up. So it took me 10 years because it took me 10 years for my kids to be a little bit older.
50 years, 100 years. I mean, what are we saying about Dr. Cash?
It's funny. So this is going to blow.
And what are we saying about Camille Cash?
So this is going to blow your mind because I've not mentioned it because it really had no impact on my current career. It's certainly infused part of who I am and in my personal makeup. But my grandfather was a doctor. My grandfather was OBGYN in Southern Georgia.
Wow.
His oldest brother, was a general surgeon in Southern Georgia. So my grandfather was one of 16 children, the youngest. His oldest brother, the first of 16, they were both doctors. They're both sons of slaves. So think about that. My uncle was a doctor in 1918.
Your uncle was?
My uncle.
Damn. I mean, he probably took the hardest road ever to become a doctor. He probably has secondhand equipment, secondhand books, every social stereotype and that he had to overcome. That's crazy. You had to really, really want to be a doctor.
You got to really, they both went to Meharry Medical College, and they both were from Southern Georgia. They both practiced medicine for a long time. I want to be a good person, a good doctor, a good mother. I give back to my community. I understand the importance of getting up and saying, I went to Howard University and I'm proud of that. This is who I am. This is my struggle. You can do it. You have to work hard. It's never going to be easy. They're not going to give it to you. But at the end of the day, I've built something. Nobody handed it to me. I didn't wait for anybody. I didn't beg for anybody to help me. You just got to go out. If you want it, you got to work. That's what it is. So if I can help somebody else follow their dream and break barriers, I'm more than happy to.
And so if anybody wants to, get in touch with you or just follow your work or, just stay in tune with what you have going on or anything like that, how would they do that?
So social media is always a great way to see what we're up to. We kind of showcase my work. We showcase new surgical techniques. So I got Camille Cash MD on Facebook. I got CamilleCashMD.com website. I have the real Dr. Cash on Instagram. I think I have a Twitter handle. I don't use it because I don't know how to tweet. I'd probably get myself into real trouble. But those are ways to see what we're doing and what I'm doing in terms of plastic surgery. And we tend to, I don't always highlight the social and the community events, but I try to give recognition. And if somebody is out there and they want to know what it takes to be a plastic surgeon, I've had usually wait for folks to be in medical school to come shadow me. But we certainly am open to having conversations that they email the practice.
Awesome. Thank you. It's been a pleasure having you on the show. But before we exit, we have our rapid fire round, and then we have a little Jeopardy that we're going to do. Now, the rules for the rapid fire, I'm going to read a sentence or say a word or ask a question, and you just have to give a one-word answer. And you can't expound on it, okay? You just have to give an answer to whatever first comes to mind, all right? So first one is U Street or Adams Morgan.
That you want me to pick one?
You got to pick one.
Adams Morgan.
Okay. Is homecoming better as an alum or as a student?
Alum.
The quad or the annex?
Oof, quad.
Okay. Next one is booty wall.
I'm sorry. I have a complete blank on booty wall.
Oh, you don't know what that wall is outside of the quad? It's called the booty wall.
The booty wall.
Yes. And I just want to, it's funny when I bring that up. I like to see people's reaction when I say that because they're not expecting it.
Okay.
All right. Drew or Carver?
Drew.
Jordan or LeBron?
Jordan. Although I love me some LeBron. Okay. But, I grew up with Jordan.
Craziest plastic surgery request?
So the craziest plastic surgery request I've had was for a woman who wanted me to inject fat to make her mons pubis or her coochie fluffier.
Mons pubis?
Yeah, I got to think of what the street term would be. They want a fupa.
Shout out to her. Shout out to her, man.
Yeah, that was a little weird for me. I was like, oh, okay.
Good for her. Hey, she went to Dr. Cash, though. She said if anybody could do this, it's Dr. Cash.
Do that.
What comes to mind when you hear this word, Mahari?
Oh, my grandfather.
Best Howard moment?
President's Picnic, 1987.
Okay. Alpha chapter?
Too many things to name. Alpha chapter. Oh, God. Burning sands. Engineering building. Having a daughter, a legacy, is the beautiful thing.
Okay. All right. Now we got some Jeopardy we're going to go into. See if you can know these things about your alma mater. And they're going to be easy, so don't worry about it.
We'll see. Finish
this sentence. Reared against the eastern sky.
Yeah. Something hilltop something high.
Proudly there on Hilltop High. Okay.
Oh, I was close.
You're close. What year was Howard founded?
1957. 67.
Oh, man. If you would have stuck with that 1957.
18.
Oh, man. I would have aired that on Instagram. All right.
1867.
Got it. You got it right. Who's the current president of Howard?
Dr. Wayne A.I. Frederick.
What is the Black national anthem?
Oh, I know it. Hold on one second. Black national anthem. Nope, that's the sorority hymn. Whoa, I know the Black national anthem. I can sing it. I just need, okay.
Lift every voice and sing.
Lift every voice and sing till earth and heaven ring. Okay. Yes.
What is the address of the quad?
Oh, address of the quad. I don't know, but it's on 6th Street, Northwest, Washington, D.C. 20059. Quad, the quad. It's on 6th Street. That's all I know.
Well, you got my next question right. What's the zip code of Howard?
20059.
Very good. Very good. So that wraps up our Jeopardy, our interview, and our rapid fire. So very good. Dr. Cash, you've been an amazing guest. I really appreciate you coming on today.
No problem.
Thank
Love
you
it. All right, HU.
Thank you for joining the HU Movemaker podcast, where we highlight folks that have contributed to the Howard legacy at the highest levels. To hear more interviews or purchase merchandise, please visit www.humovemakers.com.